Hello, everyone. Welcome to another episode of Iwing Marketplace Chat, where we give the opportunities for entrepreneurs to talk about themselves and what they do. Today, we are with Dr. Pat Elangwe, who is going to be. Today, we are with Dr. Pat Nkweteyim. My bad. Sorry. Who is going to be sharing her story with us. She's here thanks to God for helping her with the tough battle, and she's the one who's going to be explaining everything to us. And Sidney as well, Sidney Tazeh, who's the founder of CLEAR Radiology. Thanks for joining us, Dr. Pat Nkweteyim.
It's my pleasure to be here. Thank you for having me on your program.
Wow, I'm so happy to see you, especially after hearing about your story. But can you introduce yourself to some of our audience who may not have known you?
Okay. I'm Dr. Pat Nkweteyim, a university lecturer, a community leader, and a children's minister. That's who I am. Thank you.
Wow. So today we're talking about, this is the Breast Cancer Awareness Month. And I'm really glad that, what you're doing, also, encouraging people to, take this serious. What inspired you to want to share your story with us?
I think many women, many people need to hear my story so as to be encouraged and to know that cancer is real. Breast cancer is real. So I just think that they need to hear my story and get encouraged.
Wow. And so can you share us a little bit about your story? Like how did it all begin, finding out about, breast cancer
Okay.
and stuff?
Yeah, we are told to always examine our breasts. So I regularly examine my breasts. On this day, sometime in August, September last year, during self-examination, I felt a lump on my left breast. And then I had to go for consultation. I was told to do a biopsy. And then it came out that I had cancer. And my journey began. It's been
Wow.
1 year. Today, I had my last dose.
Thank God. Thank
Yeah,
God.
I'm so
I'm glad to
excited.
hear that you have your last dose.
Yeah.
Amen.
Wow. Thank God. So how was the journey? Can you walk us through like the whole process, when you realized what was the next step
Okay, when the diagnosis came out that I had breast cancer, I met my oncologist. I met a team. Actually, it was a team. And I was told I needed to begin chemotherapy. I had that 6 sessions of chemotherapy. After that, I went for surgery. I had a number of surgeries. The first one was to implant a port, the treatment port. And then I did the breast surgery. After that, I went for radiation. After radiation, I developed lymphedema, which necessitated that I do a physical therapy. So I had physical therapy for 3 months. And after that, or during the physical therapy, I had to go for another surgery. And in between these different therapies that I was taking, I was on another therapy, immunotherapy, which ended today. In fact, I had my last dose today, about 2 hours ago. Basically, that has been my journey for 1 full year.
Wow. We have to take Breast Cancer Awareness Month very serious, and
Yeah.
there are lots of people that need to watch this, that need to, listen to you and, use your story in order to also be as a way to encourage themselves,
Exactly.
So what have you learned throughout this process, throughout this difficult journey? Because I know it's a very tough position to be in.
I've come to learn that life is frighteningly fragile. Life is very fragile, very, very fragile, and it's so frightening. I've also come to learn that life is precious and that family and friends matter. It's good to be at peace with people and to live in love, because those were the things that kept me going. And I've also come to learn that we should never underestimate the power of prayer and faith in the Lord. Because if my faith in the Lord kept me going, the journey was so tough that I felt so many times like giving up. But when I remembered that Christ had paid the price, I continued the journey. I hung on. And today I can proudly say that I'm an overcomer.
Amen.
Amazing. This is amazing. So this is breast cancer awareness month, and to people that are watching this video, what advice do you have for them? What do you want? What's the takeaway from this beautiful story of courage, perseverance, and overcoming?
Yeah, I think I want everybody to know that life is precious, life is priceless. And I want to encourage my women folk to go for screening. Self-examination is very, very important. I used to just sit and wonder, what if I didn't examine myself? What if I wasn't in the attitude of doing that? What if I hadn't built that habit? This thing would have diagnosed maybe when it was already at the end stage. So I'm advising my fellow women out there, always examine yourself. Go for screening, please go for screening. The facilities are there. There's CLEAR Radiology. Go for screening, please. Don't underestimate what cancer can do. Don't think that it's far from you. It's very close. Do your screening, please. It's very important. It will save life, because early detection will save lives. That's what I
Wow.
can tell them.
Wow.
Yeah, I
Thanks.
never knew that cancer could come close to me. I had never gone for screening. I had never. But today I want to tell women, please go for screening. Go for screening. Don't delay. Go and do it now.
Wow.
Okay.
Thanks for encouraging, and thanks for sharing your story. I mean, this is a great story that we love to hear, of overcoming, perseverance, So what are some of the things that you did in order to, fight this journey? Because this is tough, going through this whole process, I mean, I don't know how someone, I mean, I really don't know how to overcome, like how did you,
Yeah, as I said, live in love. I had friends, I had my pastor, I had family that came around, even from a distance. They will call, they will encourage me. And then I also decided not to be idle. I kept my mind busy so as to take it away from the sickness. I attended conferences. Thank God for technology. I would lie on my bed and was attending conferences. I was doing my researches. Any moment that I felt strong, I would be on my students' thesis. As I said, I'm a university lecturer. I have students I'm supervising. I kept myself busy intellectually so that my mind could be taken away from this illness. And I think that is what kept me going. And then I
wow,
never underestimated the power of prayers. When I felt so low, I'll call my pastor and they will pray for me.
wow.
Yeah.
I'm really glad you kept your mind busy. You kept yourself busy, and we're here today to say thank you, God, for
Exactly.
giving you the strength, to go through this. So, what kind of process did you go through as far as the treatment was concerned?
As I said, the first thing that was done was chemotherapy.
Mhm.
I had 6 sessions. That's about 4 to 5 months. I had chemotherapy. After that, I went for surgery. I had surgery. And after my surgeries, I went for radiation. And then after the radiation, I developed lymphedema. That is, my arm was affected. I couldn't raise my arm. So I had to undergo physical therapy for 3 months. And today I wear compression garments to keep the arm active. So I think so far that has been my journey.
Wow.
And then in addition to the therapy, physical therapy or chemotherapy, I also had immunotherapy for 1 year, every 3 weeks for 1 year.
Mhm.
And that is what ended today.
Wow.
Yeah.
I'm glad to hear that. So this is Breast Cancer Awareness Month, and right here we are with Sidney Tazeh as well. Sidney, thanks for joining us.
Oh, you're welcome, Ivan. Thanks for inviting me. It's a pleasure.
Can you please introduce yourself to our audience?
Yes, so my name is Sidney Tazeh. I'm a medical physicist. I work with U.S. government. I treat veterans with cancer, brain, lung, spine cancers. I'm also a global health enthusiast. I try to explore how I can apply my knowledge to help people around the world to fight cancer, but also to live healthy lives. And but more importantly, I'm also an entrepreneur and the founder of CLEAR Radiology, which is a diagnostic and medical imaging facility in Cameroon, where we try to sensitize women, sensitize the population about living a healthy lifestyle and getting properly diagnosed, so that they can get the correct interventions when if they're properly diagnosed.
Oh, thanks again for joining us, Sydney. This is the Breast Cancer Awareness Month. What activities do you have at CLEAR Radiology, Buea?
Yes, Ivan. Yeah. So October is always one of those months where I feel like it's part of my one of my missions on Earth, the things that gives me purpose. For Breast Cancer Awareness Month, we are really trying to drive down the message about early diagnosis and people to be advocates and to take charge of your health, because we know that breast cancer is one of the few cancers that we actually have a very high cure rate for breast cancer. So I always encourage people, don't sit back and be quiet. Okay, take care of your health. Go out there and get screened. Breast cancer affects women, it affects men, and people are getting breast cancer even at a younger and younger age. And it's the one cancer that if we catch it early, we almost have a 99% chance if your cancer is caught early, which is an early stage cancer. And early stage cancer will never be caught if you're just not taking the steps needed to address your health, because early stage cancer causes no symptoms. And we know that because we have limited resources in Cameroon, the best way to get ahead of this problem with breast cancer is early diagnosis. So for this month, my organization, CLEAR Radiology and CLEAR Medical Foundation, we've partnered with a lot of other organizations in Cameroon, trying to sensitize women to have them come out to speak up, to tell them that we do have the ability to properly screen and diagnose you in Cameroon right now. Okay, but not also that, we do have options to guide you through the process for those who are actually diagnosed or who we have a suspicious result. We have steps, we have the equipment, we have the expertise, we have professionals, we have caregivers, we have doctors, radiologists, oncologists around the world who are going to be available to kind of help you through that journey. Breast cancer, you're not alone. We know that women are the backbone of our society, for our economy, and it's really important that if whatever we can do as an organization, which is CLEAR Radiology, is to help the society as in the local society, and that in as a whole would impact the entire country and the entire continent to ensure that women get screened, get sensitized for breast cancer throughout this month. And not only ending throughout this month, but my organization is going to continue sensitizing women throughout the whole year to ensure that people get screened for breast cancer.
Wow, that's amazing. Kudos to the work that you're doing. This is something that, we really, really need in our community, sensitization, for people to come out and do their regular checkups, So what's the procedure for people that want to come up for checkups and stuff like that?
Yes, so we start from the lowest, from the what we call the low hanging fruit, right? The first thing we encourage women to do is what Dr. Patricia Nkweteyim mentioned, which is self exams, because nobody knows your body better than yourself. So the first thing we do is in the privacy of your home, do a self exam, and we do teach women how to do self exam. It's actually quite easy. Or if you're not sure, you're shy, you can go online. There are reputable organizations out there that will show you how to do a breast self exam. So that's the first step. We encourage women to have those self-exams. And then for those who cannot do it, now we have a clinic in Cameroon, and there are many other clinics, including the Buea Regional Hospital and many other clinics in Cameroon that would offer you, show you how to do a self-exam. And then now there are experts, there are nurses, there are doctors who can do a clinical breast exam. And what's the difference? With the clinical breast exams, now you have an expert who now actually has a method that they follow to examine all the 4 quadrants of the breast. They examine under your arms, they examine your neck, your lymph nodes, and they do a thorough clinical breast exam. That too is free right now, because we know that that's something that can be done. We can screen a lot of women in a very short time period. So once the clinical breast exam is done, if there are any other suspicious or something that's of concern, then now we can schedule to get a breast ultrasound. The breast ultrasound is a simple test, non-painful test that we can go in, also at CLEAR Radiology, but also some few clinics in Cameroon, and use a small probe to examine the woman's breasts, okay, and see if there are any little lumps. And then usually the breast ultrasound is complemented by something we call a mammogram. A mammogram is just simply an exam where we use a special machine to deliver very low dose of X-rays that can find very tiny lesions in your breast that the ultrasound might miss and the physical exam might miss. So at CLEAR, we offer both the physical exams or the self-exams, the clinical exams, the ultrasounds, and the mammography. And those are being discounted right now to encourage more people to do it, but you can always come throughout the year. But the most important thing is that we have people who are well trained to support you. That's the message I want to give to my people in Cameroon around the world. I know that hope is one thing that is one of the biggest thing that is important when you're faced with any disease, to know that you're not alone. And I can tell the women in Cameroon that you are not alone. CLEAR Radiology has experts who know breast cancer inside out. So don't be ashamed. Come out, speak up. There are people out there who are there willing to help you. And breast cancer is curable. It's not a death sentence. It's curable, but you have to come out.
Breast cancer is curable. I love that. And I'm pretty sure, in our community, there are so many other misconceptions about breast cancer, Sidney.
Yeah.
What other misconceptions do people have when it comes to that?
Yes, so no, obviously, we do live in a society where there's a lot of misinformation that is being spread around. Some people say, okay, well, if I'm exercising and doing eating healthy, exercising, living a healthy lifestyle, I can never get breast cancer. Well, those things reduce your risk. Okay, so when it comes to breast cancer, we don't talk about whether you can have it or you cannot have it. Our goal is to reduce the risk. So we tell people that, hey, you have all these lifestyle changes that you should do, but remember that even if you do all those things, there's still a chance that you can still have breast cancer. Some people still think that breast cancer is a curse from your grandma or from some uncle or some auntie. Either way, all we tell you is that get yourself checked, because that's the most important thing. Okay, breast cancer it's an illness that can be cured. Do not sit back at home and think that if it's a death sentence, there's no help in Cameroon. A lot of people still think that, but we have excellent diagnosis in Cameroon. We have chemotherapy in Cameroon. We have radiation therapy in Cameroon. We have hormonal therapy in Cameroon. We have immunotherapy in Cameroon. Okay, They're not always easy to get, but if you have the right people around you,
Yeah.
know that you can get it. So please don't let anybody fool you. That's the biggest myth. Let nobody fool you that you cannot get help in Cameroon. Yes, you can. Yes, you can.
Yes, you can.
Wow. And Dr. Pat, how do you feel now? You know, that how can you describe
Oh my
yourself now?
goodness, I feel so happy. It's like some bag of cement was on me and it has been taken off. I'm so excited. And I just want my fellow women to know that I was in the dungeon, I'm out.
Wow.
Yeah.
Is there any other thing you would like to add? You know?
Yeah, I just want to ask, Sidney has said, I know there are so many, there's so much on the internet about healing and whatsoever, how to eat, what to eat not to get sick. It's always good to seek medical advice. Even when you are eating whatsoever, always go and do your screening.
Yes.
That's what I can tell people.
Correct. Yes, yes, absolutely. Because remember that things that that increase your risk of causing breast cancer, lifestyle is only one of them. Okay, so yes, but it's a very important one. It's a very important one. Eating healthy, exercising, that will reduce your risk of breast cancer. But there are things that you cannot control, such as your genetics. Okay, breast cancer tends to go in families, although as many as one in 89 in 9 cases of breast cancer patients have no family history, but it does fall in families. And there are also environmental factors, okay, things that get exposed to that might cause might cause you to develop cancer. Because remember, what is cancer? Cancer is just a mutation in your genes. Okay, when those genes get mutated, then they can lead to cancer. And then obviously things that you ingest. I mean, yeah, those also the food that we eat, the processed foods, and all those things can increase your risk of causing cancer, but it can never eliminate your risk. So the key is to reduce the risk, and then, but more importantly, get help. And then one key thing that Dr. Patricia talked about earlier, and that was one of the first things she talked about, was the things that she did in order to stay mentally strong. And I cannot end this conversation without really emphasizing this. And this is something that is not talked about a lot. It does not matter the kind of radiation, chemo, surgery do that you do, it will not be complete unless that patient also is able to get the correct mental health, the mental care that they need, the support, the advocacy, the resilience. That's what that gives you, that holistic approach. So I really, really encourage all survivors, families, that we should support our breast cancer patients, because remember, the medication is going to work even better when the patient is mentally strong. We know what stress does to the human body. Stress by itself would suppress your immune system. Okay, and the best way to fight cancer, the most efficient drugs in treating cancer is immunotherapy. That's the future of all cancers. So the best way, if you can get your immune system to fight cancer, why not go that route? And stress is one thing that would completely destabilize your immune system. So every time I talk about breast cancer, I really, really emphasize that our patients or our advocacy groups should promote ways in which we can reduce stress and give people hope and resilience. That way they're happy, they feel like are not alone. Because in that case, all the medications, which are excellent medications out there, they'll work even better. They'll work better. So take care of your mental health. Know that it's not a death sentence. Know that there is hope and it can be cured. If you're having difficulties dealing with it, lean onto your family. Like Dr. Nkweteyim said, lean onto your family, lean onto your church, lean onto your faith. Pray to God. God gives you hope. God heals. God says we give you medication, but now when you pray to God, you put all those together. That holistic approach, it works. It works.
Wow. Thanks for sharing that, Sidney Tazeh. And Dr. Pat, I'd like us to touch on the Life Foundation a little. I see you've been creating a huge impact in Buea with the Life Foundation. Can you tell us what the Life Foundation is all about and what encouraged you to create this organization?
Okay, the Light Foundation is a non-profit organization that has 3 branches. We have a children's wing, a youth wing, and women's wing. I was motivated by the COVID-19 COVID-19 lockdown, I got home from work one day and I had children just playing, idling in the quarter, and I heard this voice in me, gather those children. Before, I had worked with children. I love children. I was a children's minister. So I gathered them and started teaching them, using the arts to teach them, to empower them, and for them to discover their purpose in life. I came to realize that you can't effectively work with children without meeting their parents. So we started a women's wing, and we do a lot of counseling. We try to empower women too, because we want people to find purpose in life and to be useful to themselves and to their communities. So that's why we call it Delight Foundation. You be the light of your community and a delight as well. So basically, that's what we do, empowering people, especially the children. I'm passionate about children.
Wow, that's beautiful. And so what are some of the activities?
I use the
arts, like painting.
Painting, sculpture, dance, theater, music, and drama. Yeah, lots of anything arts we use to teach the children and to empower them.
Wow.
And we want them to, through arts is like a lens through which they can discover their purpose in life.
That's beautiful.
Yeah.
Wow. This has been a very insightful or impactful conversation. I've learned a lot myself, especially, how to go through situations. Sometimes you have a headache and you're defeated,
It's always good to speak out, talk to people, especially if you know people who have walked that road before.
Yes.
Nothing stops you from reaching out to them. That's one thing I did, There's a Professor Joyce Ashuntantang. She was one of the first people I called to tell them, look, that thing that happened to you is also happening to me. Yeah. And she had to, encourage me through her own story. Then I called a nurse friend of mine, Dr. Judith Foyabo Kaspa. She too was a lot of encouragement to me. And other friends and my family, people of faith, those are the people I had around me during that difficult period.
Wow. So, yeah, if you're watching this conversation or chit-chat, CLEAR Radiology provide diagnostic services. And if you go to CLEAR Radiology, you'll be able to do your mammogram, right?
Yes.
And there's a discount.
Yes. Right now, throughout the month of October, we're doing mammograms at 50% off. So yeah, come and get your mammogram. If you're 40 and above, come get your mammogram. Even if you're under 40 and you have a family history of breast cancer, we still encourage you to get a mammogram. If you're 55 and above, you should do it every 2 years. If you're between 45 and 55, you should do it every year. And for those who maybe you can't afford a mammogram, still call us. We have organizations that kind of help to sponsor women's mammogram, low-income women. And also, but I also want to kind of give out this message to my diasporans. Please sponsor somebody. Sponsor a woman. 1, 2, 5, 10 a woman. Sponsor your mammograms. And it doesn't have to be somebody that you don't know. It's your aunt, it's your mom, it's your grandma. Okay. It costs you what? $30. Okay. And then your aunt is going to be getting quality diagnostic services. And we don't only do diagnostic services, but we also assist women throughout the journey. Okay. Make sure that they're getting the correct treatments. So we guide you through. So, and right now for the diasporans, you can even pay online. You can call them directly. And just schedule it, and Claire would pick your mom up, your sister up, and provide these testing services. So you cannot say you didn't know, right? Because now we do have quality services in Cameroon. We don't have to necessarily travel abroad, but we can get those things done in Cameroon. But I really encourage my diasporans, join the fight. I really want to take this opportunity to thank my aunt, Dr. Patricia. Speaking up is probably one of the best gifts that you can give people. As somebody who's been through it, they know that you're talking from experience, and this would also spur other women to come out and speak up. Because one thing, cancer would grow in the dark. When people sit back, we get a lot of late stages, stage 4 cancers, because the women are afraid to come out. Okay, when they hear from other survivors who are glowing, like you, Auntie Patricia, who are glowing, who are doing well, then that spurs them, that encourages them to come out. So I really want to thank you for speaking up, being a voice for all the women in Cameroon. Many people are getting diagnosed a lot younger now. That's unfortunate. But the good thing is that breast cancer is curable. Don't think that it can never happen to me. It can happen to me, a man. It can happen to any woman. It can happen to anybody. But you are not alone.
Wow, thank you guys for sharing this important information with us. And what other time is it good to do this? The best Breast Cancer Awareness Month is the best time to come out and share. So please, if you're watching, share this link so more people can be blessed with this powerful information, to help us share. And also subscribe to Iwing Marketplace YouTube channel. Make sure to, like our videos and follow us, and use Iwing Marketplace app and website to support other businesses. Thank you again, Dr. Pat and Sidney Tazeh, for this.
My pleasure.
It's a pleasure. Thanks, Ivan. And yep. And happy Pink October month.
Thank you. Thank you. Together we fight.
Yes.
Yeah,
and we will win. We will win.
Good.
Wait, stand up so we can see the picture.
Okay.
We fight together.
Together we fight. I love that message. I love that message.
Yes.
Thank you, guys.
So cancer is not a battle for one person. So my fellow sisters, don't stay quiet. Talk to people. You can't fight it alone.
Thanks again. And on this note, we've come to the end of this powerful conversation. Wish you all the best in the journey. We continue to work together. I'm sure we have a lot of things to do. We'd love to have you to talk more about the Life Foundation sometime.
Okay. Thank you. It's been a pleasure.
All right. Thanks.
Okay. Thanks a lot.
All right. Bye-bye, guys.
Okay, bye-bye.
Bye.